Let's talk about joint replacement surgery. The good news is that it's getting better and more and more people are able to get them.
Yes.
The bad news is it's a really complicated decision, having watched my mother-in-law go through multiple hip replacement surgeries.
Right.
So what are things that people need to ask before they go through joint replacement surgery?
Well, one is you want to ask the experience of the surgeon. I mean, you really want, in this type of surgery, to have someone who's done hundreds of these, because they are very tricky. They have pitfalls associated with them. So experience really does matter in joint surgery.
And literally you want them to have done hundreds?
Yes,
Right.
yes.
Okay.
The second issue is about the rehab and the recovery. I mean, the surgery to go through that is stressful and painful enough, but it's really the rehab and the recovery that is also such a burden on patients. So you really need to know beforehand, before you're considering joint replacement, you know, how long are you going to be out of commission?
And what the expectation is, so that you're able to plan for that
Exactly.
in your day.
The other thing is many orthopedic practices have an associated physical medicine and rehabilitation practice associated with the practice. Is that a conflict of interest? I mean, are they self-referring? That's something you may want to think about as far as price is concerned, because your insurance company may not pay in certain circumstances.
So is it a good thing? Because you'd think that one-stop shopping and they're well connected and communicate, that that would
Yes.
be a good thing.
In many ways it is, yes.
Okay.
But in many ways, if you went outside to another physical medicine practice, maybe insurance would cover it better. I don't know. I'm not saying that it's necessarily a bad thing if your orthopedist also has their own physical medicine practice. I'm just saying it might be reasonable to ask the cost
research it.
with your insurance company.
Okay.
Then the other thing is what I mentioned earlier about pain relief was Exparel. Really the cutting edge in pain relief is the injection of these Exparel liposomal globules that can really help with pain relief. And that brings up the whole...
And that's an injection that they do before surgeries?
No, after they're
s-
closing the wound up, after the wound is closed up.
And that will then reduce the need for pain medication
That's
afterward.
right. So that
Right.
brings up the total
Right.
question of how are you going to manage my pain afterwards. Also, you'd want to ask the anesthesiologist, are there nerve blocks that can be done that can relieve pain, say 24, 48 hours after surgery? And so those are important issues to address.
In general, is general anesthesia versus a nerve block better or worse? Depends on the joint?
It depends on the joint. My experience has been that for people with hip or anything below the waist, epidural or spinal anesthesia is really quite excellent and has a less systemic effect on the entire body. People are even doing shoulder surgeries on regional block alone and giving sedation medication during the procedure so the patient's not, quote, awake.
Gotcha. Okay, so let's talk about the joint themselves, because I know there's a whole menu of the type of joint. It might be a metal joint, it might be a ceramic joint,
Right.
And it all depends on what your requirements are.
Right.
How about the length of, this was an important thing with my mother-in-law, the length of experience with a specific joint, to ask the doctor about it.
Yes.
Is it a new joint? Is it an old joint?
Yeah.
She ended up with a joint that got recalled.
Right.
Right.
So this is very controversial, and there have been many lawsuits related to the fact that joint components have come apart or their parts have been found to be defective. So it's great to know that your surgeons had a very high success rate with a particular type of joint from a particular company or vendor. So that's something great to ask.
And if a joint is going to fall apart, how long is it generally going to be?
Oh, it's so variable.
So-
It could be months afterwards, it could be years afterwards. So it all depends on the patient and the joint.
Because we always recommend, don't be first online for new drugs, don't be first online for new techniques.
true.
Because you need to see the long-term impact.
That's true.
So in this case, the same thing.
That's why people say, don't buy the first year of a model of a car, because they want to see what happens with that particular car model down the road. The same can be said with, things in medicine too.
Right. And then even it might not be a replacement, it might be a resurfacing.
Exactly.
Right. All right. A lot of great stuff. Thank you, David.
Okay.
If you like what you just saw, do me a favor, share it. The healthcare challenge is really a problem for all of us. And the more we can get this information out and get people taking better care of their health, the healthier we will all be. We have more videos with Dr. Sherer as well as his blog, What Your Doctor Isn't Telling You, at our website, bottomlineinc.com.